Insulin. In the realm of medical science, there are countless molecules and substances that play pivotal roles in maintaining our health. One such critical player in our body's intricate orchestra of functions is insulin. While it might sound complex and intimidating, understanding insulin is essential for everyone, not just medical professionals. What are insulin? Insulin is a hormone produced by a gland in our abdomen known as the pancreas. This hormone is like the conductor of a symphony, guiding the various instruments, cells, in our body to play their parts harmoniously. Its primary role is to regulate our blood sugar levels, ensuring they stay within a healthy range. Why insulin? Insulin's primary job is to control our blood sugar, or glucose, levels. Glucose is a type of sugar that our bodies use for energy. When we eat, our digestive system breaks down the carbohydrates from food into glucose, which then enters our bloodstream. This influx of glucose triggers our pancreas to release insulin. Insulin acts like a key that unlocks the doors of our cells, allowing glucose to enter. Once inside, our cells can use glucose as a source of energy. Insulin also helps our body store excess glucose in the liver for later use, preventing our blood sugar from rising too high. Without insulin, glucose would accumulate in our bloodstream, causing high blood sugar levels, which can lead to a host of health problems, including diabetes. In short, insulin is the gatekeeper that maintains the delicate balance of our blood sugar, ensuring it doesn't rise too high or fall too low. Common insulin. There are several types of insulin, each with a specific role and duration of action. The most common types include rapid-acting insulin. This type works quickly, typically within 15 minutes of injection. It's often taken just before a meal to help control post-meal blood sugar spikes. Short-acting insulin. This type starts working within 30 minutes and lasts for a few hours. It's usually taken 30 minutes before a meal. Intermediate-acting insulin. This type has a slower onset of action and lasts for a more extended period, often covering the space between meals and overnight. Long-acting insulin. Long-acting insulin provides a slow and steady release of insulin throughout the day and night. It helps maintain a consistent baseline level of insulin. Interpreting insulin results. When you undergo an insulin test, your healthcare provider is measuring the amount of insulin in your blood. The results can tell a lot about your body's ability to regulate blood sugar. Here's how to interpret insulin test results. Normal range. A normal insulin level typically falls between 2 and 25 microinternational units per milliliter, μIU per milliliter. This range may vary slightly depending on the laboratory that performs the test. Low insulin. Low insulin levels may indicate an issue with the pancreas or a condition known as type 1 diabetes, where the body doesn't produce enough insulin. High insulin. Elevated insulin levels might signal insulin resistance, a condition common in type 2 diabetes, where the body's cells do not respond effectively to insulin. High insulin levels can also result from certain medical conditions and medications. How the test is conducted. An insulin test is a simple blood test that can be done at a medical laboratory or your healthcare provider's office. Here's what you can expect during the procedure. Preparation. Fasting for at least 8 hours is usually required before the test. This means no food or drink, except for water, during this time. Your healthcare provider will provide specific instructions on fasting. Blood draw. A healthcare professional will take a small sample of your blood, usually from a vein in your arm. The process is quick and relatively painless. Analysis. The blood sample is sent to a laboratory for analysis. Technicians will measure the amount of insulin in your blood. Results. You will receive your test results, which will indicate whether your insulin levels are within the normal range or if there are any concerns that need further investigation. For whom is this test for? Insulin tests are not just for individuals with diabetes. They can be valuable for various reasons, including diabetes diagnosis. Insulin tests are often used to diagnose both type 1 and type 2 diabetes. For type 1 diabetes, low insulin levels are expected, while for type 2 diabetes, high insulin levels with high blood sugar are indicative of insulin resistance. Gestational diabetes. Pregnant women may undergo insulin testing to check for gestational diabetes, a condition that can develop during pregnancy. Polycystic ovary syndrome, PCOS. Women with PCOS, a hormonal disorder, may have insulin resistance. An insulin test can help in its diagnosis and management. Metabolic syndrome. Individuals with metabolic syndrome, a cluster of conditions that increase the risk of heart disease, stroke, and type 2 diabetes, may benefit from insulin testing to assess insulin resistance. Hypoglycemia. Low blood sugar, hypoglycemia, can be caused by various factors, including certain medications. Insulin testing can help determine the underlying cause. What diseases does this test help diagnose and manage? Insulin testing is a valuable tool for diagnosing and managing several conditions, including diabetes. The most common use of insulin tests is in diagnosing and monitoring diabetes. It helps healthcare providers determine the appropriate treatment plan, such as insulin therapy or lifestyle modifications. Gestational diabetes. During pregnancy, high insulin levels can indicate gestational diabetes, which requires careful management to protect both the mother and baby. Polycystic ovary syndrome, PCOS. Elevated insulin levels in PCOS can lead to hormonal imbalances and other health issues. Identifying insulin resistance through testing can guide treatment strategies. Metabolic syndrome. Insulin resistance is a key component of metabolic syndrome. Managing insulin levels can be crucial in preventing heart disease and type 2 diabetes in individuals with this condition. Hypoglycemia. Insulin tests can help pinpoint the cause of low blood sugar and guide treatment options, especially in cases of unexplained recurrent hypoglycemia. Conclusion. Insulin is a remarkable hormone that plays a pivotal role in maintaining our health. Understanding its functions, types, and the importance of insulin testing can empower individuals to take control of their health and make informed decisions about their well-being. Whether you have concerns about diabetes, PCOS, or other related conditions, discussing the possibility of an insulin test with your healthcare provider is a proactive step toward a healthier future. Remember, knowledge is a powerful tool on the journey to better health. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, get your all-access health pass at www.Quali.Health. Our health skills provide valuable information and guidance on specific health conditions.